A 72-year-old man comes to the physician for routine health maintenance examination. He had non-tremor dominant Parkinson disease that was diagnosed at the age of 68 after developing progressive bradykinesia and rigidity. He lives alone following the death of his wife 2 years ago. The patient's son, daughter-in-law, and grandchildren live nearby and help him with daily activities. Current medications include levodopa, carbidopa, and entacapone. He appears well. Neurological examination shows mild hypomemia, brady, uh, bradykinesia, shortened steps, mild gait shuffling. During examination, patient mentioned that he drove himself to his appointment today because he does not want to feel like burden to his son. The physician is concerned that a patient illness and medication potentially impairs his driving skills. The physician stresses that he has never had an accident in his life and is a safe driver. He cannot states that he was felt isolated since his wife's passing and likes to meet up with old friends at local bar. Which of the following is most appropriate response to this patient? So what should we do? Should we tell him not to drive? Should we inform the DMV or RTO? Or what should we do? DMV is similar to Regional Transport Office in India, and DMV is same as in United States. And what are the other situations where physician should recommend a patient not to drive? The classic scenario in young patients: alcohol and driving. When you suspect any kind of seizures disorder, they should be informed. And as a certain neurologists, they have link with the uh, transportation department, so they can tell about the patient has a seizures disorder and should not be eligible to drive for 6 months. Okay, for seizures it's 6 months to an year until there is no history of seizures. While in the so whenever there is a situation where there is an harm to the public, we should inform the patients, or we should appropriately inform the authority. Okay, whenever there is an harm to the patients or any kind of harm, you cannot drive safely, and physician should share a concern with the patient. So the answer was correct. Many of the people give. I understand you have to stay mobile while physician without official evaluation of. So this patient usually have bradykinesia and he has a weak reflexes. So patient who have weak reflexes should be avoiding driving at any cost. Patient should be declared to state licensing authority like Department of Motor Vehicles. Okay, the laws of reporting impaired drivers differ between the states. So in certain states, like in the state of Illinois, you can directly contact DMV if the patient had recent marijuana use disorder or certain seizures disorder, because this all can decreases the reflex and that can cause impaired decision making and impaired driving skills.
Thanks for watching. Please give a thumbs up and subscribe for more.